Have you ever looked at someone's smile and thought, how do their teeth look that perfect? I mean, seriously, no chips, no cracks, no awkward shapes. Today we're talking about something that secretly transforms thousands of smiles every single day. Dentist caps for teeth. And the crazy part? Most people have no idea they're even looking at them. Dr. Esma, I have to ask, are dentist caps basically the hidden trick behind those movie star smiles?
Rasim, you're not far from the truth. Dentist caps for teeth are one of the most powerful tools we have in modern dentistry. They can rebuild damaged teeth, protect weak ones, and sometimes completely change how a smile looks. But what surprises patients the most is how natural they appear once they're placed.
Okay, wait, so you're telling me that the same tiny cap can repair a broken tooth and also upgrade someone's smile? That sounds almost too simple, but here's what I'm wondering. How does a small dental cap actually stay on a tooth all day while we eat, talk, and chew?
That's exactly the question patients ask, Mr. Rasim, because the real story behind dentist caps for teeth isn't just cosmetic. It's engineering, precision, and a little bit of dental science magic.
Let me guess, Dr. Esma, a lot of people don't even realize they might need dentist caps for teeth until something awkward happens. Maybe they bite into something crunchy and suddenly feel a tiny crack. Or they notice a tooth that looks darker than the others. I've even heard friends say they avoid smiling in photos because one tooth looks slightly chipped. These things seem small at first, but they start to bother you every single day. Is that usual when people begin asking about dentist caps for teeth?
Exactly, Rasim. Many patients come in after living with these small problems for months or even years. A cracked tooth, a large filling that keeps breaking, or a tooth that simply looks worn down. These situations might seem minor, but they can weaken the structure of the tooth over time. Dentist caps for teeth are often recommended when the tooth needs strength and protection before the damage becomes more serious.
So it's not always about appearance. Sometimes it's actually preventing a much bigger dental problem later. That makes sense, but I bet many people are still wondering something important right now. How do dentists decide when a tooth really needs a cap instead of another treatment? You know what I'm realizing, Dr. Esma? A lot of people think a damaged tooth is just a cosmetic issue. Like, if it doesn't hurt, they assume it's fine, but I've heard stories where a tiny crack turns into a big problem months later. Suddenly chewing feels uncomfortable, or a tooth that once looked okay becomes sensitive. That's when people panic and wonder if they waited too long. So dentist caps for teeth aren't just about improving a smile, they're also about protecting what's already there, right?
Exactly, Rasim. Imagine a tooth that already has a large filling. Over time, that tooth becomes weaker because much of the natural structure is gone. A dentist cap acts like a protective helmet for the tooth. It surrounds the tooth and distributes the pressure when you chew. Without that support, the tooth can fracture further. Dentist caps for teeth are often the difference between saving a tooth and losing it.
That helmet comparison actually makes a lot of sense. If someone cracks a tooth while eating popcorn or nuts, they probably don't realize how much pressure their teeth handle every single day. And if a simple cap can reinforce the tooth before something worse happens, that suddenly sounds like a pretty smart move. Dr. Esma, here's something that surprised me when I started researching this topic. Dentist caps for teeth aren't some brand new cosmetic trick. It turns out that no can use this EVs. Dentists have actually been using crowns for decades to save teeth that would otherwise be lost. But today they look incredibly natural. I mean, if someone has one, you probably wouldn't even notice it. That makes me wonder, how often do dentists actually use caps in real life?
More often than people realize, Rasim. In many dental clinics, crowns are one of the most common restorative treatments. Let me give you a quick example. A patient came in with a molar that had a large filling placed years ago. Over time, the tooth began to crack. Instead of losing the tooth, we placed a custom dental cap. Within a couple of weeks, the patient could chew normally again, and the tooth was protected.
That's actually amazing. So, instead of removing the tooth completely, dentist caps for teeth can reinforce what's already there and keep it functioning like normal. Alright, Dr. Esma, now I'm curious about the science behind this, because when people hear the phrase dentist caps for teeth, they might imagine something simple, like placing a tiny shell on top of a tooth. But from what you're describing, it sounds far more precise than that. Are these caps actually designed to match the exact shape and function of the tooth?
That's a great observation, Rasim. Modern dentist caps for teeth are carefully engineered restorations. We use digital scans, detailed impressions, and advanced materials like ceramic or zirconia to create crowns that match the patient's bite and natural tooth anatomy. The goal is not only appearance but also biomechanics. The crown must distribute chewing forces correctly so the tooth underneath stays protected.
So it's basically a custom-engineered shield for the tooth. That actually sounds more like precision dentistry than a simple cosmetic fix. Alright, Dr. Esma, let's break this down because I know viewers are wondering what actually happens during the process. If someone walks into a clinic and the dentist recommends dentist caps for teeth, what are the real steps? Is it something complicated, or is the process more straightforward than people expect?
Great question, Rasim. The process usually starts with a detailed examination and digital scan of the tooth. First, we gently shape the tooth so the crown can fit precisely. Then we take a digital impression that captures the exact form of the patient's bite. A temporary crown may be placed while the custom cap is created in a dental lab. Once the permanent crown is ready, we carefully bond it onto the tooth so it looks and functions naturally.
So step by step, it's exam, shaping, scanning, and finally placing the custom cap dot. When you hear it explained like that, dentist caps for teeth suddenly sound much less intimidating. Dr. Esma, I think this is the part viewers really need to hear. Once someone gets dentist caps for teeth, are there things they should be careful about? Because I imagine people think a crown makes the tooth indestructible. Like great, problem solved forever. But teeth still deal with a lot of pressure every day.
That's an important point, Rasim. Dentist caps for teeth are very strong, but they still need proper care. One of the biggest mistakes people make is chewing extremely hard foods like ice or hard candy. Another thing I always tell patients is to keep up with daily brushing and flossing around the crown area. The cap protects the tooth structure, but the gum and surrounding tooth still need good hygiene.
So dentist caps for teeth are strong, but they're not a free pass to chew on ice cubes all day. Good habits still matter.